You know, it always comes down to people.
The first concern of people in a community is the requirement for excellent health care, and we have that.
A lot of people in the community refer to it as my hospital.
They know it's a wonderful health system.
Quality is really what the Muir name stands for.
From the outstanding, incredibly expert medical staff to our great teams of clinicians that are at the bedside.
It's a very caring group of people, and they all have the same goal.
Find out what the needs of the community are and then meet them.
And all of the people who work here are part of that commitment to quality.
We're not driven by corporate offices out of another location.
We are the community.
I think all of us as a community, we've done something incredibly special.
Over the past 3 to 5 years, we have all been extremely invested in the successful construction and building and execution of these major medical centers.
What I notice most about going into the new facility is that it's a lot more open.
The outside of the building is what draws you in.
It's just magnificent. It's a beautiful, beautifully designed space.
Every detail was considered.
There's just a sense of wellness, the colors, the wood, the water.
And it's so spacious and it's laid out so nice and it's airy and it's open and it's warm.
It just feels fresh. It's like a new house.
The physical shape and configuration of the room is a very positive thing.
There's a feeling of calm and healing.
To look out and see grass, something that simple, I think, is going to make a huge difference.
I think that what we have now is really good. I think this is just going to be better.
So for high tech, you have 3 new operating suites.
They're beautiful. They have all the state-of-the-art equipment, and I think it's going to be able to house all the new innovations that are happening in surgery.
We have a 24-bed intensive care unit.
Most ICUs are laid out in a ward-type setting.
Many years ago, hospital wards used to be 30 patients in a ward.
And that's what we're moving away from.
We have 24 very large rooms with very large windows that let a lot of light in.
That'll have views of reflecting gardens or even the front of the hospital.
And when clinicians come in to treat you, you're not competing with the patient next door who might also have another need.
A great place for nurses to care for patients, physicians to care for critically and catastrophically injured patients.
The floors and the intensive care units are so state-of-the-art and they're so nice for the patients and the families.
The patient's family can actually spend the night.
We owe it to the patient to make sure they're surrounded by people who know them and who can help them heal and inform us. You know.
When you walk into that lobby and you stop and you pause,
I couldn't tell you. I couldn't come up with a word. I mean, it is so...
We've moved services closer. The CAT scanner is right next to the resuscitation rooms.
The 3rd and 4th floors, there are 5 gardens just on those 2 floors alone.
And if you can't get outside, the amount of light that comes in. The operating rooms are right above the ER.
We already have a wonderful intensive care nursery, and the new one's going to be even better.
The new heliport will allow for patients to be brought directly to the hospital. It's an elevator ride away from advanced surgical trauma care.
Sierra Nevada mountainscape, the steel between 2 layers of glass.
Our ICU right next to the operating rooms.
A complex care unit.
it's the absolute right combination for the community and for our patients to come and to heal and to go home as soon as possible.
Healthcare is going to undergo so many changes over the next few years. But one of the things that the new facilities have allowed is a room for growth as our community grows.
It's just unbelievable. The technological advances and the capabilities that they have are just unreal.
The care that's provided here will be as good as it's always been, but the facility that we have to deliver that care is even better.
Now we're ready. We just want to get in there.
From the patient standpoint, you're not going to be able to walk through those doors and not begin to feel your life's going to be better as a result of coming to John Muir Health.